For many, periods are a monthly inconvenience, a time marked by discomfort and the need for extra care. But for a significant number of women, periods bring debilitating pain, a condition known as dysmenorrhea. This pain can be so severe that it disrupts daily activities and affects overall well-being. Despite its prevalence, period pain often gets brushed aside, dismissed as a normal part of being a woman. This dismissal can lead to a lack of understanding and empathy from those who do not experience it. This silence surrounding menstrual pain can be isolating and prevent women from seeking the help they need. The stigma attached to discussing menstrual issues only adds to the problem. It's time to break the stigma. Painful periods are not something women should have to endure silently. Open conversations can lead to better support systems and more effective treatments. Understanding the causes of period pain, whether it's primary or secondary dysmenorrhea, is the first step towards finding relief and improving women's quality of life. Primary dysmenorrhea is usually linked to the natural menstrual cycle, while secondary dysmenorrhea is often caused by underlying health issues. It's about time we normalize the conversation around periods and empower women to seek help for their pain. Support groups and educational resources can play a crucial role in this empowerment. The experience of period pain is unique to each individual. No two women experience it in exactly the same way, and the intensity can vary greatly. While some women experience mild discomfort, others face excruciating cramps that interfere with their daily lives. These cramps can be so intense that they lead to missed work or school days. This pain can be sharp, throbbing, or a dull ache, often radiating to the lower back and thighs. It can make even simple tasks feel overwhelming. The intensity and duration of pain can also vary, with some women experiencing pain only on the first day or two of their period, while others endure it for the entire duration. This prolonged pain can take a toll on mental health as well. It's crucial to remember that pain is a signal from our bodies, and persistent severe period pain is not normal. Ignoring these signals can lead to more serious health issues down the line. It's a sign that something needs attention. Seeking medical advice is essential for proper diagnosis and treatment. Whether it's primary dysmenorrhea, often linked to prostaglandins, or secondary dysmenorrhea, usually caused by underlying medical conditions, understanding the root cause is crucial for effective management. Prostaglandins are chemicals in the body that cause the muscles of the uterus to contract, leading to pain. Let's delve deeper into the two types of dysmenorrhea to understand their unique characteristics and implications. By doing so, we can better address the needs of those affected and improve their quality of life. Section 2. Demystifying dysmenorrhea, primary versus secondary. In this section, we will delve into the nuances of these two types of dysmenorrhea, shedding light on their causes, symptoms, and treatment options. Dysmenorrhea, the medical term for painful periods, is broadly categorized into two types, primary and secondary. This distinction is vital for understanding the root causes and finding the most effective relief. Understanding the difference between the two is crucial for effective diagnosis and treatment. Each type has unique characteristics that influence the approach to managing the pain and discomfort. Primary dysmenorrhea, the most common type, is characterized by menstrual cramps without any underlying pelvic disease. This type of dysmenorrhea is often seen in younger women and can be quite debilitating. It typically begins a few years after a woman starts getting her period and is thought to be caused by the natural chemicals called prostaglandins. These chemicals play a significant role in the menstrual cycle. Prostaglandins trigger uterine contractions to shed the uterine lining, leading to cramps. These contractions can vary in intensity, causing mild to severe pain. The good news is that for many women, primary dysmenorrhea tends to improve with age and after childbirth. This improvement is often due to hormonal changes and physical adaptations in the body. Secondary dysmenorrhea, on the other hand, is caused by an underlying medical condition affecting the uterus or other pelvic organs. This type of dysmenorrhea is less common, but can be more severe. This could include endometriosis, uterine fibroids, pelvic inflammatory disease, PID, or adenomyosis. Each of these conditions requires specific medical attention and treatment. Unlike primary dysmenorrhea, the pain associated with secondary dysmenorrhea often starts earlier in the menstrual cycle and lasts longer. This prolonged pain can significantly impact daily activities and quality of life. It's important to consult a healthcare professional for accurate diagnosis and treatment if you suspect secondary dysmenorrhea. Early intervention can prevent complications and improve outcomes. Recognizing the distinct characteristics of primary and secondary dysmenorrhea is essential for determining the appropriate course of action. Proper diagnosis is the first step towards effective management. While primary dysmenorrhea can often be managed with over-the-counter pain relievers and home remedies, secondary dysmenorrhea requires addressing the underlying medical condition. This may involve medication, surgery, or other medical interventions to alleviate the pain and treat the root cause.